In this module, we will discuss the records required to submit an Eon case and set the process of generating a treatment setup in motion. Here's a list of records you will need to submit a case: extraoral photos, intraoral photos, PVS impressions or intraoral scans, and bite registry, X-rays, and then treatment submission on Eon Access. Although only impressions and scans are mandatory to complete the case submission, while other records will be set as optional, it is advisable to have all the aforementioned records submitted for proper diagnosis and treatment planning. So what is the importance of submitting all records? It's important to give Eon's treatment planning team a comprehensive and full picture of the case to be able to provide the best treatment plan. High-resolution photos, i.e. intra and extraoral, are important to confirm the patient's ID, the bite, midline status, gingival condition, presence of restorations, and etc. Single arch cases require submitting both arches impressions or scans and a bite registry, as the TS is to be generated based on the patient's bite to avoid any interferences. Now we'll walk through each record in detail. Extraoral photos. 3 extraoral photos are required. The first one is a frontal photo. The second one is a frontal photo with the patient smiling. And the last one is a side profile photo. Next is intraoral photos. 5 intraoral photos are needed to check the patient's teeth alignment, periodontal and restorative condition, bite and midline status, and etc. The 5 views are upper occlusal, lower occlusal, frontal, right buccal, and left buccal. The next step is to take PVS impressions or intraoral scans and a bite registry. They should be accurate, detecting gingival details, and capturing all teeth, including the very last tooth in the arch and all teeth surfaces. Flawless impressions or scans are essential because low-quality impressions or scans will affect the fit of the aligners. Submitting low-quality impressions or scans will delay the process of TS generation and aligners manufacturing. Note that wax bite registry is not recommended, as it is prone to melting and deformation during shipping. PVS impressions or intraoral scans. PVS impressions are more commonly used and are of a less cost. However, there's an increased chance of errors and deformation in addition to the time needed for them to be shipped and received. Intraoral scans are more comfortable, less invasive, and time-saving, as there's no shipping involved. Scans are directly uploaded to Eon Access or sent through a third-party integration system. The risk of having defective scan is also less than impressions, which will decrease the chances for retakes. Bite registration using intraoral scanners should be taken on both sides to avoid any errors, and it can be sent with the scan in the same STL file or as a separate one, depending on the scanner being used. Moving forward to radiographs. A panoramic X-ray is crucial to have a closer look at the bone level, teeth restorative condition, and the presence of impacted teeth. Cephalometric radiographs are needed in cases where changes in the anteroposterior or vertical relationships were planned. The final step is to submit your case on Eon Access. Here is where all clinical findings can be reported. Also, your treatment goals, objectives, and plan can be shared with Eon's treatment planning team, and instructions or restrictions for specific teeth movements or attachment placement can be added. After submitting the case, Eon follows a certain time frame to complete the shipping of the aligners. If you are using the conventional silicone as records, the impressions will take 2 to 5 business days to be picked up and shipped to Eon. Following that, we will generate the treatment setup within 2 to 4 days, and when treatment setup is approved, aligners will take 7 to 10 business days to be delivered. The only difference in the time frame, if you are using an intraoral scanner rather than the impressions, is that the treatment planning team will start generating the TS faster as soon as the STL is received. Delays in the time frame could be a result of the following reasons: missing records, suboptimal impressions or scans, or an inexplicit treatment plan. Thank you for watching.